Hi, welcome. It's Sandy from Delphi Hypnotherapy and Stress Management. Why even consider hypnobirthing? The NHS, if you live in the United Kingdom, offers an incredible service. And I thought I would look at the main reason that people would consider hypnobirthing. And that has to be pain management, pain control. So let's look at it from what you can get for nothing on the NHS. And we do say that pain is all subjective. So is it that bad? Well, if we look at the mainstream media, especially television, we see the reality show where there are women absolutely distraught. We hear of people suffering from PTSD as a result of birthing practices that go awry. So there must be some substance to this pain that everybody experiences. So question one is, what does the NHS offer and how good is it? And I've had a look at the NHS website. Now, please bear in mind, each and every individual is in a different area. And that area offers specific practices that maybe is not offered in another area. So you must consult with your midwives. And please bear in mind, your midwife is your best friend at this stage. And you need her to help you get through this little section of your life. So let's look at gas and air. What is it? It's a mixture of oxygen and nitrous oxide gas. How long does it stay in your body? What does it do? Well, it helps to reduce pain. It's pretty instantaneous and it's in and out of your body as you breathe. From that, what are the side effects? Well, the positives is that it's safe for you, it's safe for the baby, and it's not going to harm either of you. And that's important, especially it's not going to harm the baby. You can control it. You decide how much you want and you hold the mouthpiece and you put it in your mouth as and when you need it. That is important. You are in control. But it has a few side effects. It's only a mild painkiller. Define mild, I don't know. This is from the NHS website. It can make some people drowsy, lightheaded, or nauseous. Because you're breathing through your mouth, it can make your mouth very dry, which can be uncomfortable, but it's not life-threatening. And if you have the mouthpiece in your mouth, you can't really move around. So if you're on a birthing ball, you can't bounce up and down unless you're right next to the apparatus. And if it's used in conjunction with pethidine or diamorphine, I will speak to you about those now, it can make you feel drowsy. That's option number one. You're in control, that's good. There are no side effects, that's good. And baby won't be hurt, that is good. Can you use it at home? Yes. So if you have decided you want a home birth, you can use that at home. Grand. So what's pethidine or diamorphine injections? These are injections that are usually administered to your thigh or your buttock. It takes about 20 minutes to actually start working and can last up to 2 to 4 hours in your body. Okay. They can cause nausea and vomiting. Not a great place to be if you're uncomfortable as well. They can make you drowsy. And it can inhibit the baby's breathing once the baby has been born. Not in all cases, please remember this. So if the baby is drowsy after the birth as a result of the injection, it's not likely to latch onto the breast as easily as if there had been no interference. All right? and you won't be able to use it if you use a birthing pool. Please check that though with your midwife, because that might have changed to the guidelines on the website. So please bear that in mind. And then last but not least is an epidural. And what is that? Epidurals are a local anesthetic that is administered by an anesthetist. This is not an injection. It is put into your main spinal column. And it is done in a very professional manner. It doesn't make you drowsy. It doesn't make you sick. It numbs the area around the birth canal, and so you don't feel any pain or discomfort. I know I had it when I had my children, and you feel nothing. My leg fell out the bed, and I couldn't put my leg back in the bed because I couldn't feel my leg. All right. The disadvantages of it are a lot of NHS trusts don't offer an epidural for various reasons. And is your anaesthetist available 24 hours of the day? Because you could need an epidural at 3 o'clock in the morning, and if you've planned on having an epidural, your anaesthetist may not be there at 3 o'clock in the morning. All right, just a thought. So that is number one. You are immobile in most cases as a result of the epidural. You cannot sit on a birthing ball. You cannot go to the toilet. So as a result, you might have a catheter inserted into your bladder, another medical intervention. Your baby's heart needs to be monitored. So does your NHS trust have the equipment to monitor the baby's heart? And you need to have your blood pressure monitored. So basically, your reliability to the really rushed, pushed midwives, because they then have to find someone to keep popping in to make sure that your blood pressure hasn't crashed, that your baby's heart rate is up in the right place. And you also have the catheter. Quite a lot of fuss for something that our bodies are designed to do naturally. There's other side effects are some people suffer from headaches and have back pain. That's it. There is more on the NHS website, and I urge you to go and have a look at it if you are considering it. But again, please speak to your midwife. Ask if it is given or offered in your area. Your choice in the delivery of your baby is yours. You can choose conventional or alternative. I would like you to consider the alternative, which is the hypnobirthing route. And tomorrow I will put up a little bit more information about hypnobirthing. I also would like you to consider how much input does your partner have in any of these practices in a conventional birthing practice. Is he the one sitting in the corner watching the footy on his mobile phone or playing a game? I think he deserves the recognition that he is the father and that he should participate in the birth of that baby. But again, that is a decision only you can make, and I urge you to consider that. Many blessings to you at this strange time in our lives, and God bless you all. Bye.